usually the patient presents with reduced vision when they have macular degeneration, or they might have distortion of vision where they feel things are a little bit disturbed when they are looking at things, particularly straight lines may look a little bit distorted. They might have difficulty with reading. Yeah, so those are the three things they tend to present with: blurry vision, distortion of vision, difficulty with reading. Macular degeneration is rather called age-related macular degeneration, which, as the title says, it's related to age. As we get older, we are more predisposed to getting macular degeneration. In the background, you can have where you can have, depending on your diet, depends on your genetic makeup, whether you are a smoker, you can be predisposed to getting age-related macular degeneration earlier than someone else. More common in certain families as well, or if you've got some sort of macular dystrophy as well, you can get that happening much earlier. So there are two types of macular degeneration. There is the dry age-related macular degeneration, which accounts for around 80% of the patients. And there is wet age-related macular degeneration, which accounts for around 20% of the patients. So for the dry age-related macular degeneration patients with a dry age-related macular, I usually suggest that they think about their diet, lots of dark-colored greens, and protect their eyes from bright sunlight. So mainly about the diet. There's no treatment at the moment for dry age-related macular degeneration that's available for the common public. For wet age-related macular degeneration, we have a treatment that's available now, which has been around for the last 12 or 13 years, which are injections where we use a little bit of chemical that we inject into the eye, and they have been proven to work very well. They're relatively quite safe. I've been doing them myself since 2009, and with very good outcomes. But all depends on how quickly you start the treatment, and as long as the patient keeps to their appointments, the benefits are very good with these treatments. Parallel to that, you have to think about the diet as well, lots of dark-colored greens and stuff, because if you get it in one eye, you're more likely to get the wet AMD in the other eye. Both dry and wet are not good for the people who have it. So dry is basically where there is a very slowly progressive change taking place at the back of the eye, where the retina slowly gets damaged over a long period of time. It tends to affect patients' vision. It affects their near vision, affects their night vision as well over the long term. Wet macular degeneration does the same thing, but it happens at a much faster pace, happens very quickly. So patients have the same long-term outcome, but in one, the symptoms and the damage happens much sooner, which is in wet macular degeneration compared to dry. Unfortunately, it cannot be reversed. There is some studies that have been done using a stem cell therapy to see whether it's possible to be reversed. They've done some surgeries where they've moved the retina around to see whether that would halt the progression, but none of those have been proven to reverse macular degeneration. All you can do with the treatment, if you get wet, is you can try and stall the progression or at the pace at which it tends to move ahead here.